Okay, now we're going to be talking about the individual organs of the endocrine system. We're going to leave the hypothalamus and pituitary B for the time being. Their function as the control centers of the endocrine system will be more clear, I think, when we have a general idea what the individual glands do. So we're going to start with the thyroid gland, the organ, and the hormones the thyroid gland produces. And there are two major hormones that the thyroid gland makes. First one is T3, also called triiodothyronine. And the name already gives quite a bit away. So triiodo means that you have gonna have three molecules of iodine or atoms of iodine, and thyronine is produced in the thyroid gland. And then you have T4, which, as you could guess, is also called tetraiodothyronine. However, in textbooks and even in, let's say, clinical practice and so on, you usually find the name thyroxine. So I'm gonna write it here. So thyroxine. And these two hormones, the main function is the regulation of basal metabolism of cells of your body and proper bone and brain development. They increase the basal metabolism and they are necessary for proper brain and bone development. As you could guess, it's especially children who are at risk for the deficiency of these hormones. And this is closely related to the adequacy or adequate amount of iodine in the diet. I'm going to be talking more about the deficiencies in some later video. So, two main hormones produced by the thyroid gland, T3, T4. And then there's another one, also very important for exam, and this one's called calcitonin. Calcitonin is produced by a different set of cells inside the thyroid gland, so-called C cells. Now these C cells, they are not, let's say, proper part of the thyroid gland. They are cells that sort of split off from different tissues in your body when you've been like an embryo or fetus, and they migrated inside the thyroid gland, and now they are filling the spaces between the follicles, between the places where the T3 and T4 are produced. And the function of calcitonin is to regulate the amounts of calcium in the blood. More specifically, calcitonin takes the calcium in the blood and puts it in the bone. So the final effect of increased levels of calcitonin is to decrease the serum level of calcium. So decreased serum calcium. And it really cooperates with PTH and vitamin D in achieving this calcium homeostasis or equilibrium. This is it about thyroid gland. Now you should know something about the diseases that are caused by deficiencies of these hormones. In case of thyroid gland, the most notable affliction that you can get is goiter. Goiter is pretty common. This just refers to enlargement of the thyroid gland, and is often caused by iodine deficiency. There are parts of the world where iodine is not really abundant in the diet of the indigenous people, and in these places the goiter is pretty common, and especially in kids, because you know that T3 and T4 are important for brain and bone development. Especially in kids, it can have some serious side effects. And for a long time, the iron deficiency in kids has been called cretinism. Today, we don't call it like that, we just call it endemic goiter. But just if you ever wondered what cretinism really is, it's just iron deficiency. Then you should have an idea what's hypo and hyperthyroidism. And this really refers to decreased or increased activity of thyroid gland. So hypo would be decreased, hyper would be increased activity of thyroid. And so how would that manifest? So if your thyroid hormones are affecting the basal metabolic rate, so you could assume that if you're gonna have lots and lots of T3 and T4 in your system, that's gonna make your cells to burn more fuel. So hyperthyroid people tend to be slimmer. Hypothyroid people tend to be more chubby. Also, people with hypothyroidism tend to sweat. They have tachycardia, like fast heart rate. They might have some, let's say, issues with maintaining proper body weight, and so on and so on. And hypothyroid people would have the other issues. Sometimes hypothyroidism, or instead of saying that person has hyperthyroidism, you might say that they have thyrotoxicosis. Thyrotoxicosis means increased amount of thyroid hormones in the blood. Hyperthyroidism means increased activity of the thyroid gland. Now, what's the difference, right? It might sound the same. The thing is, you might get high levels of thyroid hormone in your blood without high activity of your thyroid gland, right? And the possible reason is obvious. You can take the thyroid hormones in pills, for example, and then even though your thyroid gland would be functioning normally, or even if the activity would be decreased, you could get thyrotoxicosis, like increased amount of hormones. Yeah, but I think for your exam, hypo and hyperthyroidism should be enough.